Hey, what's going on, everybody? This is Dr. Schilling with Secoya Health, bringing you this week's Wednesday Wellness Minutes. And of course, as you read from the title, if you read it, we're going to say just forget the virus, okay? At this point, it's becoming a fever pitch as far as people are freaking out. You got the coronavirus. They don't know what it is. All they see is on the news that everybody's like, run to the store and buy every canned good you can have, every non-perishable food item you can possibly store in your house. As a result, even the CDC, the Center for Disease and Control, we'll refrain from saying, one of my mentors calls it the Center for Dumbness and Confusion. So at any rate, they're trying to do their best to help you stay safe. But what's interesting about that is it's all fear mongering. Like I think of it as wagging the dog. Like, got the election going on, let's bring up a virus. Got this going on in the economy, let's bring up a virus or something like that. So a little conspiracy theory there for you. But at any rate, what we're here to do is empower you to understand exactly what you can do at home without going anywhere, without doing anything to help yourself to fend off any virus. The secrets, if you will. Now, for me, I think about this from my standpoint. As a clinician, I'm in a clinic all day long. People are coming in, they're, drippy nose, weepy eyes, coughing, sneezing, hacking, carrying on. I'm exposed to things all day long. And I'm not worried about wearing a mask and people know if you're not feeling well, don't come in and things like that. This is a healthcare clinic. People come in because they don't feel well. They do pulse magnetics, which is one of the greatest things you can do to help yourself avoid viruses. At any rate, you want to understand the backstory when it comes to coronavirus, okay? If you remember the big SARS scare back in 2002, that one, it was a coronavirus as well. And guess where it came from? China, okay? At any rate, I don't know if there's anything tied into it. It just happens to be like 2002 and now it's 2020. Mix the numbers around. Anyway, just having fun with it anyway. But so why are people freaking out about this, right? Because it can cause pneumonia, like any of one of the coronaviruses. This one is this is the seventh coronavirus that they've categorized, and it's number 9, the COVID 19, something like that is the code name for it that they're doing. But you want to know who's going to get sick from this. Like any virus, anyone who's not feeling well is more susceptible. Anyone who is young, who has an incompetent, an uneducated immune system, or someone who's in the elderly age who is not immunocompromised, but they're less able to fend things off. So people in the middle don't typically get this stuff. I mean, at this point, I think one person has died in Washington State and one person on the East Coast, and there's a couple cases in California, and people are freaking out. I think Anissa was just in seeing a nurse practitioner for a yearly checkup or whatever, and they said, well, there's only been 2 cases in California, so we're not, and she's like, 2 cases of what? Well, the coronavirus, don't you know? And she's like, I'm not worried about that. And her PA was like, you're not worried about that? Anyway, basically, if you go anywhere into medicine and medical care and hospitals and stuff like that, it's basically bananas, okay? Everybody's going crazy. So don't worry about running off to, Cub, Whole Foods, Trader Joe's, anything like that, and clean out the shelves because this is not Armageddon, okay? Simple things here we're going to go to in a second, but we've already talked about who gets sick from it, generally speaking. There is no specific test for it. Basically, you're symptomatic. And then they say, it's kind of like Lyme disease. Like, oh, you have all these boxes we're going to check. We don't have a lab test for it that is actually accurate, so we're just going to tell you we have that. We're going to treat you for that. So they're freaking people out. They're spraying people down in China. They're quarantining people in airports. They're not letting people off or on of cruise ships and stuff like that. So what you want to understand is that just like SARS, it can cause pneumonia. So I believe it's called novel coronavirus pneumonia, so NCP. So pneumonia is, of course, potentially life-threatening, but the reason they call it novel is because it's a new form. Viruses mutate, they change, they modify their DNA based on their environment, they're adapting. So what you want to understand is that this is novel, which means it's new. It doesn't mean it's something to be scared of because we've had coronaviruses before. And I'm not sure exactly the statistic, if I can say that fast and slow, how many people passed as a result of the SARS scare, but it was way blown out of proportion. Just look at video footage on YouTube or something from the SARS scare. It's pretty crazy. But, okay, so there's so much information and misinformation out there about the coronavirus that Facebook, Google, Amazon, all the leaders of those companies got together with the World Health Organization. I think it was at Facebook's health headquarters. Thanks, Facebook. To discuss how to control the misinformation. So I don't want to alarm you here, but the information you're receiving, like in your feed and from Google and things like that, is being manipulated. And they're controlling what you're seeing. It's kind of like we think about in China where the government controls. Well, now the companies think that they know like how to control misinformation and this and that. The problem is that's called censorship. And I'm not suggesting people should publish false data or fake news and stuff like that. But at the same time, you have to be educated and understand where you can get your information from that's unbiased and things like that. There's a website called Green Med Info is a great website. I don't know how long it'll be before they're censored and whatnot, but Green Med Info is a great resource for general information. The Townsend Letter, there's a bunch of them out there that are unbiased and they're actually peer-reviewed and things like that. So when you want information, go there. If you want to search for something, I think there's it's called DuckDuckGo, I think is the web search engine, which is unbiased and not monitoring. It's not going to give you, once you go on a website, if you go to a web page, it'll drop a cookie on your phone or your computer. And next thing you know, you go searching Facebook and your ads pop up for what you just searched for. That's called a cookie, all right? It's a breadcrumb trail that they follow you with. And as a result, go to DuckDuckGo, which I have no affiliation with, but I've heard about recently, they don't track you. They don't track every move you make, and they're not selling your data to Big Brother and everything like that. So anyway, I'm going to segue back into the purpose of this because I wanted to inform you about that and help you feel like you can get your information somewhere without having it biased. So if the big players are trying to figure out how to control how much information you know, and the news organizations have the 24-hour news cycle trying to keep you scared, fear is going to suppress your immune system in the first place. So first of all, don't turn on the news. Okay? And if you see stuff about this, just shut it off. It's not helping you. It's only going to scare you and suppress your immune system. Because fear drives up your corticosteroids, your cortisol and things like that, which suppresses your immune system. So just say no to the news. They had the Just Say No to Drugs campaign. Now it's just say no to the news. Because there's nothing unbiased about the news. Doesn't matter if it's Fox, CNN, I mean, even public television is probably biased at this point. Who knows? But just understand you need to do your due diligence and have more than one source of information than just simply say, oh yeah, they just tell me how to think, or what to think rather. So what are some simple things you can do at home? Well, sleep is probably one of the most important things you can do to maintain a healthy immune system. From there, you want to eat healthy, right? Eat the rainbow. Eat multicolored fruits and vegetables, which is going to boost up your immune system. Naturally, the other side of that coin is avoiding sugar and processed foods. If you can do that, you're going to be way ahead of the curve. What I do at night is I shut off our Wi-Fi router. Now, I can't protect us from everything in the world because you turn on our computer and there's 15, 20 different Wi-Fi signals, but at least you can control yours. So shut your phone off, turn on airplane mode, turn your Wi-Fi router off, lessen the signal strength that's affecting you during your sleep. That's good things you can do at home. Also, exercising regularly is a great way to boost your immune system. It doesn't have to be crazy. You don't have to go out and run 10 miles or anything like that. For a 4-minute Tabata, okay, look up Tabata. It's a great exercise. Alternating exercises and rest for 20 seconds on, 10 seconds off for 4 minutes, and you're done. Like, dude, can't get any more simple than that. Body weight exercises, you don't need to do anything too fancy. Regular exercise. Quality proteins. Your body needs protein in order to repair your body. Okay, most of what you're touching is protein. Okay. Your body needs protein to build, needs protein to detoxify and things like that, and it needs that to rebuild your immune system when it's in struggle. So high quality proteins are really important. Nutritional supplementation, right? You can do that all day long in order to boost your immune system. A lot of the data they're suppressing on the internet is that high dose vitamin C is very effective for combating viruses. It slows the replication, if not suppresses it completely. So they're doing IVs of 12 to 24,000 milligrams of IV vitamin C, and even 200 milligrams a day is going to help you prevent things, which is great because you don't have to take a lot. We use I don't know if I have one in here. Yeah, sure. Liposomal vitamin C. Liposomal means it's going to be absorbed into the cells and does not have to be digested through processed through the digestive system. But liposomal. So let's see, half teaspoon of this. 500 milligrams. Sweet. So this is your prevention right here. So take a squirt of this at night and 1 in the morning, okay, and relax. Keep calm and forget about the virus because it's not going to be an issue. So we talked about vitamin C. We got vitamin D. I'm sure vitamin E would help as well. Vitamin K. Let's see. Reishi mushroom. So Ganoderma lucidum is one of the most widely prescribed herbs in China for immune support. Reishi mushroom is great for helping limit replication of viruses, helping it keep it from spreading. And then zinc, of course, is really good. You get the zinc lozenges, or we got zinc assay and stuff like that. high quality omega-3s. We use plant-based because we try to avoid the fish because they need to be processed heavily, but high quality omega-3s are great. Probiotics help your gut health because 70% of your immune system is in your gut. And then from there you can do some selenium, you can do echinacea. There's a bunch of different things you can do. Keep it simple. Vitamin D, vitamin C. I mean, pretty much going to rock yourself, keep yourself strong, okay? Sleep, exercise, proper food nutrition, avoiding alcohol, sugar, junk foods, anything in a box, really, stuff like that. So these are going to be the keys that are going to help you stay ahead of the game and avoid this stuff. And if you think that you probably haven't been exposed to the coronavirus yet, you've already been exposed to some coronaviruses, okay? Remember, this is COVID-19, this is the 7th one. So this new one, right, from China, this is the 7th one. So these coronaviruses aren't new. Some of them infect animals, some of them are transmitted from animals to humans. Don't worry about scruffy or fluffy, they're just fine. But understand that these things are in your environment. So you can't walk around like, the walls are coming in, the viruses, okay? You have 50 trillion human cells in your body. You have 500 trillion bacteria, molds, parasites, funguses, and viruses living in you and on you at all times, okay? You're not getting exposed to much new, okay? Maybe a different variant of it, but if you have a strong immune system, you're not going to have to worry about it. So everybody take a deep breath. Okay, like we said with my daughter. 1, 2, 3, I'm taking care of me, right? Take your vitamins, get your sleep, exercise, proper nutrition, avoid the junk, don't do too much booze, get rid of the coffee, diuretics and things like that are stressing you out. Simple stuff, okay? This is going to be helpful for you because if you take these simple steps, you can avoid any mania that has to do with coronavirus or any other virus whatsoever, okay? So these are the secrets. Play it back if you need to. Amelia will be writing up a synopsis about this and pushing it out to our team, to our population, the Secoya Nation, if you will. But just relax. The virus is not going to kill you. If you're sick, then maybe avoid people, but wash your hands. It's pretty simple. But trying to dodge every person that's coughing, sneezing, hacking, and carrying on. Most people are carriers of this or some form of viruses, and they don't even know for 2 to 14 days that they have any symptoms, and some of them are never symptomatic at all. So thinking you need to hide in your house or not go to work or whatever it needs to do, it's not going to help you. Okay, so boost up your immune system with, A, D, E, and K, vitamins, sleep, exercise, proper nutrition, avoid the junk, all the stuff we just mentioned. Okay, so we will see you next week for the Wednesday Wellness Minutes. Let us know if this has been beneficial. Let us know how we can help you and empower you to stay away from the craziness that's being fed in the media, and share it with friends and family so that they are empowered to understand that we don't need to be afraid of just yet another virus, because guess what? They're already here and they're not going anywhere anytime soon. Okay? All right. Have a great night. We'll talk to you soon. Bye, guys.